Good evening, Kristen. Thanks so much. This is The Beat, and I am Ari Melber. And let me tell you off the top, tonight is actually one of those nights that we think could be special. We have been working for a while on a report digging into what some Democrats say is key to Joe Biden beating Trump in November. It will be a new installment from our Backstory series, and that's coming up in just a few minutes. But we begin right now with news on this COVID relief bill. Republican senators releasing a proposal to start negotiations, cut current money for people who lost jobs by $400. Steve Mnuchin and the chief of staff of the White House heading to Capitol Hill to work on the details. And against that backdrop, the coronavirus again hitting Donald Trump's inner circle. National Security Advisor Robert O'Brien testing positive. The White House says he did not pose any infectious risk to the president or vice president. And let me tell you, as we kick things off, it's not all bad news. The first large-scale coronavirus vaccine trial begins today, officially. And this is serious stuff. 30,000 different people will be studied. Scientists are hoping they could have the results as soon as November. And many are eager for any sign of progress here, as the U.S. case count has topped 4.2 million with 147,000 deaths. Let's get right to it. I'm joined by Jason Johnson, professor at Morgan State University and political contributor to MSNBC and The Grio, and a very special guest, the world-renowned molecular biologist, Dr. David Ho. We should mention he is winner of Time Magazine's Man of the Year. That was in '96 for groundbreaking research in AIDS and AIDS treatment. Dr. Ho is the director of Columbia's AIDS Research Center and is currently leading a team trying to develop this vaccine in the fight against the virus. Two great guests. Good to see both of you.
Good to see you with you.
Doctor, we'd love to start the week with good news, but obviously it's only really good news if it's true and accurate. So walk us through your views of everything going on in this hunt for the vaccine. And then I'm going to turn to Jason on some of the Washington wrangling.
Well, vaccine development against COVID-19 is unprecedented in scale and in speed. As you've just mentioned, there are a number of vaccine candidates in clinical trials already, 17 that I know of, and probably another 150 or so in development that have yet to reach the clinic. And as you just reported, we have one large trial that's going into what we call efficacy study. And that is very important to assess whether the vaccine actually protects or not. And it's really moving very rapidly. And, you know, obviously reaching this point means it's past the phase 1-2. So there's sufficient data to support moving on and sufficient safety information. So it's all good, but we need to be aware of the fact that we don't know whether the vaccine will work in elderly individuals or those with underlying conditions. We certainly don't know about long-term complications, if any. So we still need to be cautious while the prospects are good.
Doctor, are you more confident than you would have been, say, 2 or 3 months ago?
Yes, I think it's important that some of these leading vaccine candidates have moved beyond phase 1. That's a very important achievement. But of course, the ultimate test is coming up in the ensuing months.
Sure. Excellent. We'll stay with us on that. I like to divide up by expertise. I'm not going to drag you into trying to fact check or handicap Larry Kudlow. But I will have Jason do it. Take a listen to the famed economic advisor. And by the way, former guest. I've had him on this program. But here's what he's claiming, Jason. Take a listen.
You're in a housing boom right now. You're in a retail sales boom right now. You're in an auto car boom right now. Manufacturing, look at the ISM indexes. All are booming.
Jason.
Yeah, I don't know what he's talking about. First off, you have large numbers of Americans who are desperate right now because the rent exemption ended last weekend. A lot of people have already seen their last of their $600 checks. I tweeted about this last week. You had people at the Senate Majority Leader's house last week chanting, Mitch McConnell better have my money. People are furious out there. So the idea that somehow everybody is perfectly fine and there's boomings and people are buying houses and buying cars, that is simply not what's happening in the streets of America.
And what does it tell you that the White House is so eager to sort of point to areas where there may be pockets of growth, there may be okay stock market results, which is fine. I mean, anyone in America would welcome anything going up rather than down. But as you mentioned, the day-to-day, the big thing that happened over the weekend was 12 million more people are at risk of being evicted during a pandemic recession of no fault of their own, strictly because of government inaction, Jason.
Right. And Ari, we have to remember, back in May, Mitch McConnell said, you know what, I'm pretty much done legislating on this. We don't really see the urgency of the situation. So they have sat on this problem for months as Democrats have put forward several different plans. There's implications to this that I really don't think the Senate Majority Leader is realizing. Cory Gardner and Susan Collins, there are Republicans right now who, if they can't bring something home when it comes to relief in the middle of the pandemic, they're going to lose their jobs. And I don't understand why they fail to see it. But look, Republicans may not care about the humanity part, but I don't see how they're missing the political element to this, because this is a losing move by them to try and come up with something at the last minute that probably won't pass.
Very interesting to hear you break that all down, given, as we say, these negotiations that we're tracking into the evening, which, again, I mentioned this on Friday. This affects, obviously, people's lives. People are out of work. Right. People are trying to make trade-offs in their health security. People are trying to figure out what to do with their kids' education. And then you have Congress, according to many, dithering. Jason, stay with me. Turning back to the doctor on the medical side, I want to read a little bit from some of what we're hearing from Dr. Fauci and these ongoing tensions about what the facts really are. Fauci's saying, we keep hearing when we go to the task force meetings, everything's being corrected. But when you go out of the trenches, you still hear about things being way worse on the ground, whether that is doctor shortages of protective gear, ranging from that to what, according to the New York Times and other accounts, were tensions on the task force between Dr. Birx saying, oh, we have models that look good, particularly if you just hope certain numbers keep projecting a certain way. And I'm not, no shade against models, but they're just a guide, to what is reportedly Dr. Fauci's style, doctor of really learning and listening to what's going on anecdotally as well. I'm curious where you come down on all of that, and do you see any signs of improvement or learning from the government?
I am extremely disappointed with where we stand with respect to the outbreak in this country. I think we have a scenario where the epidemic is still spiking, more or less like a developing country when we are the strongest and richest nation in the world. And that's because we haven't had the political leadership. We didn't have the will or commitment to want to address this pandemic properly. We better get going, otherwise the caseload will continue to rise and the death toll will follow. I'm completely in the same position as that advocated by Dr. Fauci all along. We need to act now.
Right.
When you look at this, and obviously these are challenges, but do you see at this point, given what's available, what's known publicly about what was initially a new virus, do you see the federal government failing to learn on the job at this point, failing to adjust?
I could see it being a bit slow in picking up our response, say back in January, February, but this is not excusable anymore. We have seen this virus spread for months and months, and the New York experience should have been telling the rest of the country what to do, and yet each region seems to be repeating the same mistake. And we should not be talking about shortage of tests or PPE at this point. We should be well prepared as a strong nation, and yet we know tests are still inadequate, and many patients are waiting for days or even weeks for a proper test result. That's not excusable.
Oh, I'm sorry. Finish, doctor. My bad.
No, I'm done.
Okay, Jason.
And the doctor makes an excellent point when we talk about the failure to distribute resources properly by this government. You see the opening of sports leagues now, the NFL and basketball and baseball and everything else like that. They're administering tests that can give people COVID results in 15 minutes. 15 minutes. Now, look, I want to see LeBron play as much as the next person, but why we can't have those kinds of resources for frontline workers, for nurses, for doctors, for dentists, for people who are out there, for school teachers who are supposed to be opening. What I don't think anyone realizes, and certainly the Senate Majority Leader doesn't seem to get this as clearly as he should, is that the more you force things to open too soon, the longer term consequences we're all going to have to deal with as there's another explosion of coronavirus once we start the fall, once we start hurricane season, and once flu season begins. This is an absolute failure of policy, both morally and just organizationally on the part of the federal government.
Right. Makes a lot of sense. Dr. Ho, before I let you go, do you have time for a quick joke?
Sure.
You were Times Person of the Year. Do you know whether Donald Trump was jealous of you for that at the time?
I don't think at the time he was considered.
Yeah. Well, that's a very light shade right there. Dr. David Ho and Jason Johnson, I want to thank both of you on all matters, serious and light. We're going to fit in a break, but we have a lot in the program. Attorney General Barr will be facing